Hello everyone, welcome to another Mighty Explained video. Today we're going to be talking about Horner syndrome, which is basically an interruption of the sympathetic innervation of the eye and face, which originates from the cervical sympathetic chain fibers. So this would result in a clinical picture as I'm about to describe to you now, although it is important to understand that these symptoms do present ipsilaterally to the lesion. So the first symptom that you're going to see would be miosis, which is pupillary constriction. And this takes place because once you knock out the sympathetics of the face, you have unopposed parasympathetics, and the parasympathetics innervate the sphincter pupillae muscle of the eye, which leaves you with a constantly constricted pupil. Next, you have ptosis, which is eyelid drooping, and the reason behind this is the muscle called the superior tarsal muscle, which is responsible for keeping the eye open, and it's innervated by sympathetics. So just like before, when you knock out the sympathetics, you're left with a drooping eyelid. Lastly, you're going to see anhidrosis, which means lack of sweating, and this is due to the fact that the sweat glands of the face are innervated by sympathetics. So lack of sympathetics results in lack of sweating. I've drawn a picture over here below that'll kind of help you visualize what the clinical picture looks like. So over here on this side, we have the affected side, and on this side we have normal. It might not seem normal, but it's normal. So over here you can see drooping eyelid, which signifies the ptosis, and then over here it might be a little bit hard to appreciate, but this pupil is smaller than this pupil, so that signifies the pupillary constriction and the miosis. And lastly, over here, I've drawn a cactus and a tumbleweed to signify a dry face, so ultimately lack of sweating and anhidrosis. So the Horner syndrome can be caused by a number of things: stroke, tumors, trauma, damage to blood vessels in the heart, in the neck, wherever. But it's important to understand that the treatment the mainstay of treatment typically involves treating the underlying cause. It can be idiopathic sometimes, but there is no direct treatment for Horner syndrome itself. It's typically to identify whatever is causing the Horner syndrome and treating that, and hopefully the Horner syndrome will resolve. That's all I have for you guys today. So if you do have any questions, comments, or concerns, please leave them in the comment section below. Otherwise, I'll see you guys at the next video.